advocacy for the same. He chairs and he's on many national committees integrating climate change with the medical curriculum. He's also with SDG Councils for Skill Development. No, I have to introduce you, though you don't require introduction. So I'm giving it hand over to Dr. Alexander.
Thank you, Shilpa, for those kind words. I must reiterate that it's the team, and we've got a fantastic team in all these organizations, especially in H.E.L.P. And once again, on behalf of the Public Health Foundation of India, Healthcare Without Harm, and the steering committee of Health Environment Leadership Platform, Raj is here, Srinath, Sanjay, all the regional leads, and the state chapter presidents from almost all the states in the country. On behalf of all of them, a very, very warm welcome to you today, and thank you for being here. So I thought, as we open this conference, I thought we'll start with a question. Why are we here today? And let me try and answer it. We are here because climate change is no longer a distant environmental concern. It is one of the defining health crises of our time. In fact, I think it is recognized as the most pressing healthcare crisis in this century. We are here because healthcare, while being dedicated to healing, is responsible, as Vishnu was saying, almost 5% of the global greenhouse gas emissions. You'll hear this figure again and again and again. If healthcare were a country, we'd be the 5th largest polluter in the world. We are here because of another reason. Healthcare remains one of the most trusted voices in society. And as trusted voices, we must lead. We are here also because the era of awareness is over. The era of action has begun. We are here because the front line of climate change runs through our hospitals, clinics, and communities. The evidence is impossible to ignore, and I'll just read out a few statistics. In 2025, out of the first 334 days, 331 days, we had floods, heat waves, storms, and extreme weather conditions which claimed thousands of lives and disrupted millions more. Again, I'm talking about Indian statistics because we're having the conference in India. In 2024, India actually recorded the hottest ever year with 41,000 suspected heat stroke cases reported through the public health system. But let me add a note of caution here. The Lancet countdown warns that if the global temperatures increase by 2 degrees, India could see an additional 120, almost 130,000 deaths. This is only among the older adults. So from 41,000 in 2024, in the next few years, if our temperature goes up, you're talking at least about 6 to 7 times the number. So I think it's very important that we keep all this in mind. And these figures are only part of the crisis. We all know that climate change is expanding the reach of dengue and malaria, worsening air pollution, threatening food and water security, and hitting the most vulnerable the hardest. Always the case. The poor, the children, the older adults, pregnant women, outdoor workers, and marginalized communities. And again, yesterday at our round table, we were talking about the impact of technology. All of us in the health industry and the community are using ChatGPT, AI, and these are also becoming challenges. The amount of electricity, the amount of water being used in these areas is huge, and if there's something is not done about it, we're going to end up in problem. And another, I was just sharing yesterday at the round table that in the US, many communities are now suing AI companies because of the noise pollution. So these are all unintended consequences, but very much true. So our hospitals are also feeling the strain. Patient loads are rising, infrastructure is under pressure, energy, water, workforce capacity, and disaster preparation are being tested like never before. There's also the other truth we must confront, which I mentioned earlier, that though we exist to protect health, we are actually contributing to the very threat that we seek to address. So in trying to heal as healthcare professionals, we are unintentionally adding to the harm. That is why healthcare, we cannot afford to stand on the sidelines, and that is where I think all of us would agree that, as I mentioned earlier, that as a trusted voice, healthcare must lead. This journey did not begin today. I'm sure that many of you sitting here would remember the conference at AHPI, Association of Healthcare Providers, which I'm part of, and PHFI organized in Delhi maybe about 5 years ago, one of the earliest climate and health conclaves. At that time, people really didn't think it was too much of a problem, but now things have changed. People are aware. The evidence of today's conference that almost 600 people are registered. We had to stop registrations. And HELP has evolved from a small community to a much growing national movement. And we have moved beyond conversation. Today we have partners from government, academic institutions, professional bodies, centers of excellence. We are training healthcare professionals, shaping policy, advancing research, and encouraging innovation. So I think now progress demands collective action. We are very fortunate, as I said, to have Public Health Foundation of India and Healthcare Without Harm. These two organizations really add a lot of credibility to what we are doing. The book that we wrote 5 years ago wasn't really moving well, but in the last 2 years, it's been doing very well. Many hospitals are using it, and that has encouraged us to now write a book on a global edition of the same. So my hope that this meeting will not just be another conference that diagnoses problems. It's a conclave that generates practical solutions, that challenges conventional thinking, and defines the next chapter of healthcare leadership on climate action. And as we repeatedly say, from awareness, we need to move to action, from sustainability to resilience, and from concern to commitment. We hope that today's deliberation will communicate in a practical white paper which we will share. Climate change is no longer somebody else's problem. I think it is our problem, and healthcare must be part of the solution. Thank you very much.
Thank you. Thank you, sir, for the wonderful setting the context and the insights. I hand over now to Dr. Gambhir.
First of all, a big hand to Yashoda Group for organizing this wonderful event. Friends, we are proud to be associated with Healthcare Without Harm. HELP and PHFI deserve another round of applause for this. This is an organization which is US-based and very reputed. And I have a proud privilege of introducing to you the CEO of Healthcare Without Harm, Ms. Emily Bancroft. With over a decade of leadership at Village Reach, she has strengthened health systems through government partnerships, supply chains, and digital health innovations. Now guiding Healthcare Without Harm, Ms. Bancroft is a leading bold new face focused on zero emissions, climate resilience, and equity in healthcare. She underscores the urgency of tackling the climate crisis, highlighting its disproportionate impact on vulnerable communities. Friends, join me welcoming a video address by Ms. Emily Bancroft, the CEO of Healthcare Without Harm. Please give a big round of applause for this video address.
Namaste. Respected dignitaries, healthcare leaders, colleagues, and friends, my name is Emily Bancroft, and I'm the Chief Executive Officer of Healthcare Without Harm. I would like to express my sincere gratitude to the organizers of the H.E.L.P Conference, to Yashoda Hospitals, and to all partners for bringing us together to discuss a topic that is critical for the future of healthcare, how we can build systems that protect both people and the planet. The climate crisis is a public health emergency, and health systems are at the front line. The healthcare sector is also unique. It's the one sector that has within it the commitment and the responsibility to heal and not to harm. And everything we see in research and in our lived experience reminds us that climate change is already a health emergency. Every indicator is moving faster than anticipated, and the impacts are showing up in your clinics, in your hospitals, and in your communities. And yet, the institutions created to heal us cannot continue to contribute to the environmental harms that make people sick, nor can they falter as climate-driven disasters intensify. So health systems must rapidly reduce their environmental footprint while also strengthening their ability to deliver care before, during, and after climate shocks. This idea of climate resilient healthcare, it's not optional. It is fundamental to protecting patients, safeguarding communities, and upholding the sector's healing mission. And the good news is that the healthcare sector is also a leader in developing solutions. Teams in your health systems are directly engaged in studying the impacts of rising heat-related illness, mental health of clinicians and communities based on climate impacts, worsening air quality, vector-borne diseases, the impact of plastics, and the disproportionate burden of all these things on vulnerable communities and populations. And this research aligns with what you experience daily. This idea that climate is not a distant environmental issue. It is here and it is reshaping the practice of medicine today. All of you who are attending the H.E.L.P Conference are healthcare leaders and partners who are proving that the sector can and must be part of the solution. Despite shifting policy landscapes, you are all in this room driving massive change, reducing environmental impact, saving money, and improving the quality of patient care, all at the same time. And what we see in India is a healthcare sector that's moving beyond doing no harm to becoming a partner in healing, healing our patients, healing our communities, and healing the environment which sustains us all. And you're learning to operate at all three of these levels and to find solutions that work for everyone, including finding ways to save money for the health system and reduce the overall costs of healthcare on people. We are all part of the first generation of health professionals and public health professionals practicing climate resilient healthcare delivery. But every generation after ours will also need to continue to adapt and innovate along these lines. You are all part of this growing movement. And you're not alone. Along with the leadership of the H.E.L.P network in India, Healthcare Without Harm has developed additional partnerships in the US, in Europe, in Latin America, Southeast Asia, and in Africa. We now have over 2,300 institutional members across 88 countries, and we collaborate with thousands of hospitals and clinicians. There are many health organizations that are now addressing climate impacts and environmental health, more now than ever before. This is progress, and India has been leading the way in helping to create this sector-wide shift. The work you'll hear about over the course of the day today is a demonstration of what is possible when health systems step forward with urgency and with innovation. And this work is not just driving change for India. India is leading the way in showing the world what climate resilient healthcare looks like in action. Leaders, policymakers, and practitioners around the world are drawing from your experiences, adapting them to their own contexts, and accelerating progress towards resilient health systems that protect both people and the planet. I want to thank the H.E.L.P Steering Committee under the leadership of Dr. Alexander Thomas. I also want to thank Professor Sanjay Zope, President of the Public Health Foundation of India, for their partnership in H.E.L.P, and Dr. Linge from Yashoda Hospital for being such a gracious host. I wish you all impactful and productive deliberations today, and I look forward to seeing your work in action, both in India and on the global stage. Thank you.
Very good morning to everyone. I'm Dr. Keerthana. So it's my pleasure to introduce Dr. Subbarayan Prakash ji, a surgeon turned health insurance strategist who bridges clinical insight, policy, and the insurance ecosystem. Sir, to please come on to the dais, sir. So at the General Insurance Council, he leads initiatives shaping health insurance policies and partnership that impact 140 crore Indians with a focus on penetration, claim management, and fraud mitigation, and also payer-provider dialogue. Early as a managing director at Star Health Insurance, he spearheaded mass health schemes covering over 12 crore lives, and built a nationwide hospital network of more than 12,000 facilities. A very good morning, sir, and a grand welcome to you to the H.E.L.P Conference, sir. Thank you.
Respected dignitaries on the stage, the organizers, my good friend Dr. Alexander Thomas, ladies and gentlemen, I'm very glad to be in this session, first of its kind, where it's beyond health. I always keep telling that a good physician should start looking past his job, outside his specialty, and beyond the institution. And this conference is something where we are I was surprised to hear that 4% of the environmental pollution is contributed by healthcare. And I do not know how many clinicians or hospital administrators are aware of this fact. So this is very pertinent for every one of us to look into the environment. But I'm very thankful to Dr. Alexander Thomas for choosing me, because what is insurance and environment? A hospital administrator or an owner can look at environment, I can confidently say, only when he is at his comfort. And when does this comfort come? This comfort comes in when his P&L is stable, when there are good volumes, when his brand is recognized, when there are no debts or liabilities. Only then you have the mindset to look into, okay, what he can contribute towards quality and environment. And how can this brand image and volume come in? Through association with the insurance. And today, close to 6 to 7 crore people have coverage under retail health insurance, and 23 crore plus people have employer-based group health insurance. This volume is around 1,37 crores today. And the insurance is paying more than 1 lakh crore to hospitals. What is required is the hospitals and insurance to be in sync. So my dear friends, here the designing of the policy is done by the insurers. But when the customer comes to them, they are not delivering the service. The delivery of service is done by the hospitals. And there cannot be a disconnect between design and delivery. There is always a feeling from the insurers that hospitals overbill. And the hospital have a feeling that insurance underpay and they delay. Both are partly right. But what is absent is neutral standards, reliable data, and a structured grievance redressal forums. And all these are possible through a dialogue, through an interaction, but we are working on silos and suspicions. So once that mindset changes, definitely it is possible. It should happen with every stakeholder, be it the hospital or the patient or the insurance company. Within the hospital, the billing person at the front office has no oversight of what procedure is being done. And the doctor, specialist who is doing the surgery, has no idea of what a billing is, how a billing is made. And insurance companies, so what I'm trying to say, disconnect has got a lot of cultural and financial impact. And finally, the customer satisfaction that we want to achieve is based on this. Clinicians often feel that finance monetizes the care. I am serving the patient, I am taking the call, I am answering to all the patients' attenders' issues, but finance monetizes my care. The finance department has a feeling that clinicians doesn't have an idea of the cost. They break their head on reaching their P&L. So this type of disconnect within the stakeholders, disconnect inter-stakeholders, all these things have to be addressed. And most important of all, the third stakeholder, insurance, hospitals, the third is public. The public perception on health. We are not in the days of 70s, 80s, where a single family doctor comes and touches us and we get all that. This is an era of advanced diagnostics, in-depth evaluation, and every specialist, they are accountable for their opinion. So the patient has to run through a series of tests. Just with a prescription, we cannot manage as we have been doing in the past. And public should understand that beyond food, cloth, and shelter, they should allocate for health. But there is always a feeling in India that healthcare can be made available inexpensive or a subsidized care or even free. We always see them when they come out of the hospital. When they go to the hospital, they are very expensive. They are very anxious. They tell the doctor, "Sir, do whatever you want." But when they come out of the hospital, they never say that, "Sir, yeah, I'm happy. I got my problem solved." The first question they say is, "Sir, they charged me so many dollars, so many rupees, so many lakhs." So the perception has to change. Who has to change it? But we are working in silos. I can tell you the ecosystem can flourish. The healthcare ecosystem can flourish only if we start suspecting and working in silos, and we have to work in a harmonious way. Because any problem to a single stakeholder will affect the whole ecosystem. We are all part of a pixels in a massive mosaic. We can exist and we only make sense as a whole. We need to understand that. But unfortunately, in a social media and between the patients, if we start accusing ourselves, then, we cannot reach a progress. Now, having spoken about the pain points and issues, I want to come to the solution. What is the solution? In these few minutes, we have to understand where we are and we have to frame a solution. Solution is constant collaboration, engagement between hospitals and insurance in a very frank and transparent way. Giving importance to giving importance to data and seeing that you monitor the outcome. Days are not far when insurance is going to ask for your outcome. And it is not only standardization of the workflow, standardization of treatment guidelines, standardization of process, it is going to be standardization of outcome. When you want to come for an insurance renewal, by 2030, they are going to ask for your outcome. And based on the outcome, your tariff and renewals are going to be fixed. But are we prepared for it? I only request, ladies and gentlemen, and my dear colleagues, let us equip ourselves with this knowledge. Let us understand the basic nuances of insurance. Let insurance people understand the dynamics of hospitals. Let there be constant interaction. From General Insurance Council, we have created the Roundtable Advisory, first of its kind. The General Insurance Council represents all the 32 health insurance companies, be it public sector or private or standalone insurance companies. All the companies doing health insurance in India come under General Insurance Council, and the council has created a Roundtable Advisory where we constantly interact. And in such interaction, I would request Dr. Alexander Thomas to see that these issues are also discussed. So because I am aware of this, because I had the opportunity to attend this forum, I want every one of the stakeholders to understand the importance of environment. So we can take the benefit of this Roundtable Advisory. The next thing is, we are trying to empanel small and medium hospitals through a common empanelment program where the hospital can sign and get empaneled to all the 32 insurance companies. But this was meant only for the small and medium, less than 50-bed hospitals. For the bigger hospitals, we are yet to arrive at a formula on how we can measure the infrastructure, categorize, and then decide on the cost. The third thing is a common grievance redressal forum. This is very important. There are grievance redressal between patients and the insurance authorities. They can reach the consumer forum or ombudsman. But between the hospitals and insurance companies, we want to create a common grievance redressal forum. From the Roundtable Advisory, we have a group of people who are working on it. Dr. Naren Sehgal, my good friend, is here from Association of Healthcare Physicians of India. And Dr. Lallu Joseph from CMC Vellore. She's the president of Consortium of Accredited Hospitals of India. They are all here. They are all working together with insurance for the first time, where we are all trying to work together and see that how we can create a legal framework based on which we can address the grievances. And once we address the grievances, we can ascertain quality services to our patients. Once hospitals and insurance are together, the quality of care and patient satisfaction is going to be immense. And towards this noble calling, I request you all again, instead of proving our point, let us look at peace and harmony. Let us work together, keep our internal environment happy and comfortable, then we can go into the external environment. Towards this noble and holy calling. I wish you all Godspeed, and I thank again the organizers for this opportunity. God bless.
Friends, Global Green and Healthy Hospitals is another arm of healthcare without harm. And it is again a US-based body. And special message to all the to send this message across that once you get the membership of HELP, you have to
really fantastic to know that all of you are getting together and building time for collaboration and connection on the movement for sustainable healthcare. I wish I could be with you today, but instead I wanted to share a few quick messages with you all. And first and foremost, I want to thank my colleagues and the team at the Public Health Foundation of India for all of their fantastic work organizing this event and all their work to build the HELP network across the country. Additionally, want to thank the HELP Steering Committee for their leadership in really driving the growth and action and commitment of the HELP network in India. It's been fantastic to see this steering committee come together, to also engage state leaders. And finally, thank you to all of you HELP members who are here, who have made commitments for your hospital to sustainable, climate resilient healthcare. It really takes all of us making that commitment and working together to realize this change that we want to see in the world. So in my role at Healthcare Without Harm, I am the Senior Network Director of Global Green and Healthy Hospitals, which many of you know that HELP is a part of Global Green and Healthy Hospitals, what we call GGHH for India. So GGHH is very similar to HELP, and HELP is a part of a global network of nearly 2,500 healthcare institutions, ranging from individual hospitals to large public health systems, public, private, ministries of health, rural, urban, and everything in between, a really diverse group of institutions committed to this work. We are celebrating our 15th anniversary this year, which is a major milestone for us. And the work that's been happening in India has really been a great part of this network, both locally in the region, in Asia and Southeast Asia as well, and globally. We really see this as a collective effort to drive change across the health sector, and really see it important to create networks that allow for collaboration, just like you're having today amongst colleagues there in India, but also regionally and internationally, to learn from one another, to problem solve together, to address challenges together, and to really create the solutions that we want to see in the world in the healthcare sector. So with our 15th anniversary, we are gearing up for some exciting things to happen later this year. The past 15 years have been amazing in terms of the growth of the network, both the breadth and depth, seeing the expansion happen all around the world, where we have members in close to 90 countries right now, and also to see the ambition and commitment of members increase year after year. What we saw is one member working on waste has evolved into them working to address plastics, to address energy use, address their climate impact. And that evolution is really amazing to see, and exactly what we want to see from members and all of you out in the world doing this work. With our 15th anniversary, we are going to be bringing out a lot of exciting things to engage in, really wanting to improve the member experience, how we can support hospitals and the people working at them, like yourselves, to really access the tools, the information, the knowledge that you need to be able to be successful in your work. So we're going to be bringing out a lot of new collaboration platforms, educational opportunities, ways that you can collaborate like you are today in person, but also virtually, and really looking at driving action in some new focused areas around climate resilience and plastics. These are two areas that at Healthcare Without Harm and with our colleagues around the world and our partners such as the Public Health Foundation of India, we've identified it as the two main areas, the two crises that we see of utmost importance in the world that the healthcare sector is both contributing to, but also has a huge opportunity to solve. So we're really excited to bring this to you, really excited to open up a new chapter. And we see the work happening in India and the work that you're all doing as really paramount importance to drive this change. Again, it's been amazing to see the growth that's happened over the last year across the country. It's great to see the state level networks starting to form. It's great to see interest at all levels in this work happening both across in the country and across the region. So we're really looking forward to bringing you into this next chapter of GGHH, continuing to support the work that's happening nationally, but bringing your stories and success to the rest of the world, allowing you to tap into the knowledge and expertise of other members just like yourselves out in the world, and to really form a strong movement of collective action and commitment that is working to improve the climate resilience of healthcare, reduce its environmental footprint, reduce its use of plastics, and really become a model for sustainability around the world. So we hope you have a really fruitful conference there today, and we look forward to hearing about it and continuing to hear about all the amazing work that you do every day at your facility. So thanks so much and enjoy the conference.
I think that was a great first session for a beginning, and I would request Dr. Alexander Thomas to kindly hand over the mementos to the chairs as well as to the speaker, and I request Dr. Jogesh Gambhir to hand over a memento to Dr. Alexander Thomas. While the mementos are being handed over, I'd like to call upon the next session because you don't want to waste time. So we're living in an era, it's about from innovation to inclusion, technology, AI, and telemedicine.